Thank you and welcome once again. So our patient, we are continuing with our patient Chepkurui. Now we have seen how to complete the depression screening form. Now we are moving to cervical cancer assessment because you can see here our client is due for screening, for cancer screening. Now we shall go to cervical cancer assessment. Now make sure the date is correct and the time. Now cervical cancer screening assessment form. Have you been screened for cervical cancer within the past 1 year? You'll say maybe say no. Refer for screening. Yes. Provider. We need a provider. So let us see if there's any provider. I will choose. Then this form is very short. As you can see, it's just ask if the client has been screened or not. If not, are you referring for screening? So let us select yes. Now the referring officer is there. Then you enter the form. Just as simple as that. Now we move to cervical cancer screening form. That was assessment form. Now this is screening. After screening your client, that is for clinician, this is the form that we fill. Now visit type. Was it the first time for the client for the cancer screening? So this was initial. Screening method. Can use this one. Treatment today. So we shall come here. Screening type. First time screening. Then we go to result. The result is negative. Then treatment for today will be none. Referred out, no. Next appointment date, because our client is negative, we shall give her January 2023 2nd. That is after 1 year. So this form is straightforward. We now enter our form. You can see our available forms. We have only 4 items remaining. 4 items remaining, and this one are completed ones. So let me give you a break so that when we come back, we shall do the generalized anxiety disorder. Then we shall check our patient out so that we figure out when the patient comes after 3 months, what will happen. Thank you. Continue watching and learning.